Hi, my name is Allison Bick. I will be a P3 pharmacy student at SDSU this upcoming fall.
Hi, my name is Chandra. I am an MS2 at USD Sanford School of Medicine. Allison and I are here in Bowdle doing a 3-week summer rotation through the REPS program. We are super excited to show you around the town and also the healthcare center. Stan and Allison here, we're sitting in front of the state's tallest water tower. Just kidding, it's actually over there.
Okay, now we are going to give you a little tour of both the clinic and the hospital here in Bowdle.
We're going to start the tour with the clinic portion of the Bowdle Healthcare Center. So first thing we have is the doctor suite. There's a few recliners and a TV for them to just hang out. And that full bathroom with a shower, especially if they have long nights. If there's an admin at the hospital and to stay here, it's perfect. The break room, and then we have our providers. Travis is one of the 2 PAs. Dr. Kessler is the MD here. Wayne is the 2nd PA. So that kind of makes up the portion of our clinic, 2 PAs and 1 physician. Mary is the clinic manager, and she has essentially set up everything for us to be here, so we love Mary.
Okay, so this is the procedure room. And here they just do like standard clinic procedures like mole removals and cyst removals. We actually were fortunate enough today to watch a cyst removal, so that was a pretty cool experience for us here. And then across the room, or across the hall, is an exam room. It's one of the 6 exam rooms that are in the clinic. So there's 2 exam rooms per provider. So on top of those 6 exam rooms, there are also these 2 exam rooms that are used for more specific purposes. This one in particular is used for foot care. This one over here is more focused on geriatric patients. So they have different tools in here that help mobilize the patients, get them moving. That thing over there is used to like help them get up and then walk across the room.
Hey guys, this is the entrance of the healthcare center. So you'll come in this way, and the first person you'll see is Sam. She, to adhere with the COVID precautions, she will first ask the basic questions. Have you had fever, chills, all of those that you'll see, and then she actually will take temp counts as well, just to see if anyone has a fever. And then patients are given a mask. There's also child masks in here. And then they're escorted either to the waiting room or the hospital is that way, and we'll head that way in a little bit here. But this is the waiting room. It's really nice and really spacious. They have a little area for coffee, tea, water, snacks, and this is the little kids area. Right now, our community project, which was about good hand washing etiquette. So we are now getting a little bit closer to the hospital section of the healthcare center. So even though it's after hours, so at 9:45 at night, obviously there's going to be admits at the hospital, and it's policy to have masks on right now with everything going on. Speaking of that, although the healthcare center has not had to have a lot of people back here because they haven't had positive cases yet in this county or in this to the clinic, they do have precautions set. So back here is where they have what they call a COVID room. So if a patient has a fever and they need to be tested, that's where they go. And then there's another room where the provider will gear up in full PPE, do the test, and go from there. They also have an isolation room in the hospital where if a patient is waiting for results, they do test positive, that they will remain. So so the hospital is ready for a patient if they have one. Okay, this is the emergency room. We'll show you guys around in here. There are 2 hospital beds here. Thankfully, they don't really have to use these rooms for a lot of trauma, but this room is definitely used a lot for other things. And so Bowdle itself has about 500 people, but they serve community outside, of course. Selby, Java, Casca, Hosmer, Hoven, to name a few. So the hospital system has about 3,000 patients that will be seen here. So, okay, so we are now at another side of the hospital. So this is the radiology office. On Mondays and Fridays, Charlie comes and he performs both echoes and ultrasound. Otherwise, they have a CT machine, which we'll show you, and they also do x-ray. So let's show you the x-ray here first. This is their x-ray room over here, and then we will go. And they have a 16 slicer CT scan. And then the responses obviously come in really quick, and they're viewed just right here, and then sent straight to the provider that needs to see them. Granted, they might not be in Bowdle, but it gets sent quickly to like Aberdeen, Mobridge, Sioux Falls, wherever the information needs to go.
They have a Pyxis machine that holds all their meds that they use. They actually send the orders over to Avera, and then a pharmacist at Avera will check them, verify them, and then it gets sent back here where then they can take it out of the Pyxis. So now we will give you a tour of one of the hospital rooms. This hospital has 10 rooms in it, one of which is being used right now as the isolation room for if they were to have a COVID patient. And it has 12 beds total, so they can have 12 patients at a time if needed.
Hi, I'm Dr. Lacey Kessler. I'm a physician and I trained at the University of North Dakota for both my undergraduate and medical school, and I did my residency at the All True Family Medicine Residency in Grand Forks, North Dakota.
And I'm Wayne Waschenberger, physician assistant. I trained at University of North Dakota physician assistant program, background in nursing prior to that. Worked in emergency room setting for many years, family practice, ortho, and cardiology. I think one of the big things is being a bit well-rounded, seeing a lot of different things, whether it be cardiology, ortho, trauma. It makes a big difference because you're going to be covering a clinic, a hospital, and in our situation, we cover our nursing home as well. So being well-rounded in your medical career will help you in a rural setting.
I think the reason that I chose to practice family medicine in a rural setting has a lot to do with the continuity of care for my patients. I think it is amazing that I can see a patient within the clinical setting. I can follow them to the emergency department should they need that visit. I can take care of them inpatient in the hospital, through rehabilitation in our swing bed setting, to our long-term care setting in the nursing home, and being able to have, some involvement in all of those different spectrums of their care is huge for me, and it really does push you from an intellectual standpoint to keep your practices very current and kind of integrate modern medicine and modern treatment into what's considered more of a traditional role where the family physician is doing kind of everything or pieces of everything, and it brings all of your training to the forefront and really challenges you every day to push yourself to keep learning and do what you need to for your patients. So I think that's the main draw for me, and knowing my patients, knowing who they are. When we get a call to the ER that they say the patient that's there, and I know who that is, and I know their medical history, and I think I may know what's going on, it really, I think, lends a different perspective and a different ability to care for the patient.
Mm-hmm.
Lacey is my daughter, and so it's been kind of interesting. I was looking forward to working with her, and it's been just as I expected. Working with her has been great. We get along very well, both from a professional but as a family group. She's a good boss to work for, as being my boss, basically as my preceptor, or not my preceptor, but my what do we call
Attending.
that? Attending, yeah.
Supervisor.
And so she's my supervising physician, and she does an excellent job, and we get along fine. There's no arguments. We don't talk shop when we go home, and so that's kind of the main thing. So it's been really fun.
Yeah, I think it is unique that we work together as being family ourselves, because I think we present a really strong team front for our patients, bringing towards the clinical side and more experience, and then bringing some of the new information straight out of school. I think that really makes us a strong team to where we can kind of go back and forth and discuss things really quite openly with our patients, and not being afraid to critique in a positive way to provide excellent care. I think it's really been a really great experience.
It's the old school medicine versus new school medicine,
and how
you
that
can
comes,
pick which
how that
one's
comes
the old
together,
school.
how that comes together and really benefits the patient. I think it's been really awesome.
It has.
My biggest advice would be work hard to build a good foundation of knowledge that you can rely on to build your practice, but don't worry and fret about numbers, ranking, scores, and things along those lines. Work on building that foundation so you can bring a strong clinical base to your patients. When you are, out there on your clinical rotations and in residency, work hard to get those experiences. Always put everything you have into each rotation and take as much as you can from it, because your patients are going to have that expectation that you know as much as you can to bring forward your foundation of knowledge to them. Work on getting to know your patients, understanding where they're at so you can bring what they need to them at the level that they're at. I think it's really important that you do that and understand the social, financial, all of the different dynamics so you can provide really excellent care.
Greatly, I think that it would have to do with relationships, because I'm able to have a very close relationship with our employees, and especially a very close relationship with the providers. We get to know each other and spend a great deal of time together, and we're way more open, and I have way more accessibility to them and they to me. As far as if we have an issue, we can take care of it right away, which I have a feeling in a large facility it would probably be more like schedule a meeting and we'll do it in a week or two. And the one thing that I really feel about the small clinic is we become family. We celebrate birthdays together. We have a great time together. We have laughter and joy together. And when something happens to one of us that's a sad event, of course, we all feel it. So basically, I think the huge difference is that we're family.
I would echo that with my staff and my relationships with the providers, the doctor, the PAs, the nursing staff, and so on. My relationships with my staff and my little drugstore uptown. I do wear a lot of hats in the community. Being the only pharmacist in a small town this size with one little drugstore and a hospital, a clinic, and a nursing home. Of course, I have enjoyed 35 years of successfully running my own pharmacy uptown. I find that I have a great working relationship too with the prescribers up here. I go and do drug regimen review at the nursing home every month, and I find that they're very open to my suggestions that I make about possible changes in the drug therapy for the residents there. It's brought me a lot of satisfaction. Just this week I got a really nice thank you note from a customer thanking me for the way I do patient counseling and take an interest in her personally, and I make sure that before she leaves the store she knows exactly what her drug is and how to take it and what the side effects are and so on. It was really unexpected. She actually sent in a payment and sent me this very nice, gracious note thanking me for my service. That's the kind of thing that really makes it rewarding. I've worked long hours to try to keep up at the store and at the hospital and the nursing home. All in all, it's just been really rewarding to be the small town pharmacist. Been great raising our family in a little town like this. Just a great way to raise kids, in an environment with no congestion, essentially no pollution, essentially very low crime rate. So it's just been a really great 35 years for me here in this little town and working in my drugstore and in the healthcare facility.